A very good afternoon to everyone. We are live from Prime Health page, Facebook page, and of course, Prime channel, YouTube. Thank you everyone for joining us today. A very important session, another one that we have today. It's all about ENT. It's all about your sinusitis. I have with me here Dr. Shahriyar, who is a specialist ENT. In fact, and let me just tell you that Dr. Shahriyar has an extensive experience of more than a decade, I should say, around the globe, and he's having fellowship in European Board. He's also a membership. He also holds a membership of Royal College of Surgeons. He's been practicing ENT in the Gulf and probably for the past 5 years. As we all know, that the topic of the day is it's about your nasal allergy and sinusitis, and a lot of people are worried about it. People who want to take care of this, but unfortunately they might not be getting the right guidance on this part. So we've got doctor here who will be helping us today in giving us a detailed explanation. Just wanted to tell you that we are going to have an initial presentation from the doctor, and after that Dr. Shahriyar will be ready to answer all your questions. So doctor, without any further delay, thank you very much for joining us. Over to you. Thank you.
Thank you, Fahad. Good afternoon, everyone. I'm Dr. Shahriyar, and I welcome you on behalf of Prime Healthcare Group. And today we are live from Prime Medical Center, Barsha, which is a premier healthcare facility of South Dubai. I just want to reaffirm our motto, that is personalized care personally. So now coming to our presentation today, the topic is nasal allergy and sinusitis. What happened in the last 3 to 4 months is that a lot of my patients came to my clinic and they say that if we sneeze in a public place, all the eyeballs are focused on us and we become center of attraction. Doctor, you know that we are having nasal allergy and we are not having COVID. So that's why I thought we should talk about this topic. It is an essential topic, especially in this part of the world. A lot of people suffer from the nasal allergies and sinusitis. So today we will be talking about nasal allergy, sinusitis, and in the end of presentation, I'll be also highlighting the post-COVID changes in the nasal and sinus health as we are heading towards a post-COVID era. So there are a few guidelines which I'll be able to share with you. And lastly, I will be attending to some questions and answers. So let's start with this exciting presentation. So allergy, this word we have heard from our childhood. What is an allergy? An allergy is an immune response by a human body to an ordinarily harmless substance called an allergen in genetically prone person. Broadly speaking, allergies are of 4 types. Most common is the nasal allergy, 10%, lung allergy, or we call it asthma, which is around 3 to 7%, food allergy, less than 3%, and skin allergy, which is less than 1%. Now we come to today's question, what is nasal allergy? Nasal allergy, or some people call it allergic rhinitis or hay fever, it is a condition in which when a person inhales an allergen, it is the inner lining of the nose which gets inflamed and swollen, and it results in obstruction and disruption of the quality of life per se. Up to 30% of the world population, according to a recent research, suffers from nasal allergy sometime in life, once or twice in life, or sometimes suffer more. In Europe and UK, we had approximately 25% of the population suffering from nasal allergy. And in Middle East, there was a big study in 2012, which I'm quoting, which says that 20% of the people suffer from nasal allergy and sinus-related issues. This is 1 in 5 people. This is a huge number. So what is the cause of nasal allergy? It's purely genetic or hereditary. As per the latest research, the children whose both parents suffer from allergy or asthma, they have 3 to 6 times greater risk of developing allergies or nasal allergies. Basically, there are two types of nasal allergies. There is a seasonal allergy and there is a perennial allergy. So, seasonal allergy, it appears around the particular seasons of the year, most commonly in springs, that's March and April. That's why I thought this presentation is important because this is the time when most people suffer from attacks of allergic rhinitis. And October and November, these are the two seasons mostly, the reason being pollen or grass, which I will discuss in further slides. The second one is perennial. The allergy remains all through the year, and they are slow. Their symptoms deteriorate. Now, the important thing, triggers. So, what triggers an allergy attack? The most common is dust, what we call as dust allergy. It's not the dust per se, it's the dust mite which causes the allergy. Then is pollen, grass. These are the two common allergens found when we go outside in the garden or in the parks. They are present. Moulds are just fungal elements which are present in damp and old buildings. And whenever, for example, we turn on the AC after a long time, these moulds can come out and precipitate an attack of allergy. Then pets. It's not the pets who cause the allergy, it's the pet dander, what remains in their fur, which precipitate an attack of allergy. Then it's cold air. We live here, and the AC is important all through the year. So some people say the doctor, as soon as we open the AC, we have an attack of allergy. So yes, cold air is an allergen. Smoke, yes, smoke is an allergen, especially in children. Unfortunately, some parents smoking in the common rooms, their children get an attack of asthma or nasal allergy. So, smoke is one of the common factors. Perfumes and fumes, for example, coming out of the kitchen or some incense sticks or bakhur, these are also precipitants for the allergy. Now, how does it present? I may tell you, whenever a person has an allergy attack, it really he or she really suffers. First of all, the nasal presentations. We have watery nasal discharge, nasal block, sneezing, itching in the nose or itching in the eyes, watery eyes, blocked or muffled ears. See, this is one thing which most people don't know. The nasal allergy can also affect our ears, and we can have some mucus plugs inside the ears. People have decreased hearing, especially in children. They suffer from allergy, and this is their growing stage. They suffer from silent hearing loss, which goes unnoticed. And that's how the development is not proper. Then throat irritation. People have to breathe through the mouth. They don't have because the nose is blocked, so they have an irritated throat as well as dry mouth. So what to do? Once the attack is there, it's the time to visit to your ENT specialist. So once you come to our clinic, we do a basic examination. We take the history and we do a nasal endoscopy. It is an important tool to diagnose the grade of allergy because there are different grades, and for each grade there is a different treatment. As you can see in the figure, grade 0 is not that severe as grade 3, and grade 4 almost the nasal airway is blocked. So it's an important way to diagnose. Then there are some blood tests in which we can find out the approximate amount of the allergen in the blood. There are some specialized tests like skin prick tests, which we can assess the amount of allergy. And there are some allergen tests. Basically, allergen tests test which allergen you're allergic to. So there are around respiratory allergens and there are food allergens. So we can test both of these allergens. This is the nasal endoscope. So this nasal endoscopy as well as the allergy test can be done as you can come as walk-in in Prime Medical Center Barsha, Prime Medical Center Alvarka. In fact, all the Prime Medical Center branches as well as in our hospital. We can do the nasal endoscopy as well as the allergen test on the same day. There is zero waiting time for that, and you can get the results as soon as possible. Moving on to the management. Yes, as everybody says, first is us, we have to change. Like it's the patient who has to change the lifestyle. So there are some important lifestyle changes which include avoidance of allergens. But the difficult question is, how do we know that what the allergen is? Although the allergen tests can tell us what the allergens are, but still there are some other ways like avoidance of smoking in the common areas of the house. In fact, smoking should be avoided at all. Avoid pets, or at least the pets should not be allowed in the bedrooms. Damp dusting or use of vacuum cleaners. The children suffering from allergic rhinitis or the adults also, their rooms should be cleaned frequently, and they should not use the furry duvets or the curtains. More of a neat and clean leather upholstery should be included. Dehumidifiers in the buildings in which we have a lot of humidity, you can use dehumidifiers. All these facts are desirable, but yet they are time consuming, and at times it is impracticable in long term. So now we come to the medical management. Yes, nasal allergy has a medical treatment. As I said, it depends upon the nasal endoscopy and the test, depending upon which grade you are. There is a guideline from American Rhinology Association. There are nice guidelines from UK, and there is European guidelines. All of these guidelines are for allergic rhinitis, and different people, we give different types of medication to different type of people. I highly recommend not to go to pharmacy to use these over the counter sprays which cause us more harm than benefit. We have nasal sprays, there are oral tablets, and now there is a new thing called immunotherapy. It's a non-pharmacological way to treat allergy. What is immunotherapy? Immunotherapy means it's a desensitization therapy. We give the allergen in a very, very small dose, and we increase the dose over the time. This immunotherapy lasts for up to 3 years. The results are mixed, but yes, immunotherapy is developing, and a few of my patients have had help with immunotherapy. The next treatment is surgical treatment. So the people who don't respond to medical treatment, or who fail their medical treatment, the quality of life is worse. Their school days or their office days get wasted. In those patients, we offer surgical treatment. Moreover, the people who have nasal polyps, these are grape-like structures which form in chronic allergic rhinitis. These people need a surgery, and they need to get their airway. It's very difficult to have a blocked nose and to live with a blocked nose. So we offer them surgical treatment. We offer this surgical treatment at the state-of-the-art hospital, which is Prime Hospital located in Al Garud. And I personally prefer coblation. Coblation is the latest technique for turbinate surgery. In fact, all the surgeries we in the ENT we can use the coblator. There are laser surgeries also. There are nasal septal surgeries. Although we are doing all the surgeries without the scars, we are doing all the surgeries with the help of endoscopes. So there will be no scar, no pain, no suture, and the polypectomy also done with a microdebrider. All the instruments are available in our hospital, and it should be like a day case. It's very easy. So if the allergic rhinitis is left untreated, yes, there are complications, and two of the most common complications are nasal polyposis and sinusitis. Now we will come to the second part of our presentation, which is sinusitis. Yes, this word is very common. And yes, people do suffer from sinusitis, and it's a really, it affects our quality of life. So usually people come to my clinic, doctor, I have a sinus. So what is a sinus? So sinuses are basically empty spaces in our human skull. They are around our forehead, they are below our eyes, and they are around our cheekbones. So the basic aim of the sinuses is to decrease the weight of the human skull. They are humidifiers of the air which we take in, and they're important in the quality of voice for the humans. So they are important. What is sinusitis? So, a sinusitis is an inflammation or swelling of the tissue lining the sinuses. Healthy sinuses are filled with air, but when they become blocked or filled with fluid, germs can grow and they can cause an infection. According to a study, 35 million Americans have sinusitis each 1 year. That's a huge number. Roughly around 10 to 30% of the people suffer from sinusitis globally. So the cause of sinusitis is infectious or allergic. So basically, there are two types of sinusitis. There is an infectious sinusitis. There is an allergic sinusitis. Again, infection due to bacteria, due to fungus, or due to virus. So what happens? A viral infection, an influenza, or any other common cold virus. You're having a cold, and this cold left untreated goes into the sinus, the bacteria multiply, and we get a swollen sinus. Similarly, in allergies, severe allergies or untreated allergies move into the sinus and they get a secondary bacterial infection. So the patient usually presents with severe facial pain or a pressure in the head or facial reason. So the patient presents with a facial pressure, especially when we are doing sujood, when we pray. The patient says that my head becomes very heavy when I bend my head. Then patients come with a stuffed nose. They have a thick nasal discharge. Although there is a difference. In allergic rhinitis, the nasal discharge is watery, it's thin. But in sinusitis, it is thick. It can be yellow, it can be green, or it can be amber colored, or sometimes blood can be mixed with the discharge. Again, the patient comes with headache, severe headaches. Sometimes they go to our colleagues in neurology, sometimes they go to the internal medicine, but ultimately they send us the patients with the sinus inflammation and sinusitis. Of course, they can present with cough because in some patients, the post nasal discharge, the discharge from the nose goes in the back of the throat, and then they have a continuous hawking or irritation in their throat and they present with cough. The minor symptoms, some people present with fever, bad breath. Yes, this is a common symptom. And some people say that, doctor, I smell everything is bad. They smell some putrefied or they smell whatever they smell, it's bad because they are smelling their own sinus. That's where this bad smell is coming. Some people have fatigue, some people have dental pain. I also have referrals from my dental colleagues who ultimately come with sinusitis because the sinus is the roof of the dental denture is our sinuses. So the teeth, the roof of the teeth is our sinuses. So, how to diagnose a case of sinusitis? Yes, they present in our clinic. As I told earlier, we do a diagnostic nasal endoscopy and we check for the sinuses. We check any pus or any polyps inside the nasal cavity. Again, we have x rays, CT scans, MRIs. We do any whichever investigation is needed depending upon the severity of sinusitis. We do these investigations in all of our medical centers, including the Premier Diagnostic Center, which is located in Dehra. So the types. There are three types of sinusitis. First one is acute sinusitis. Patient comes with acute symptoms, runny nose, mucus in the nose, headache, facial pain within last 4 weeks. Usually people come in 10 to 15 days time with sinusitis. But there are some people who come after 4 and before 12 weeks. This type of sinusitis is acute on chronic sinusitis. They get an attack of cold, then they are okay for a few days. Then after 1 week, they again start with the whole story. And then there is the final one, which is called chronic sinusitis. This lasts for almost 3 months and on. So, how do we manage the sinusitis? First of all, we have medical management. For acute cases, we give medical management, which includes antibiotics if there is an infective cause. We give nasal saline wash, which is also called nasal douching. Nasal sprays are important, antihistamines, and anti inflammatory medication. So, depending upon the grade, the type, which we can assess in our ENT clinic, and then accordingly we can prescribe. There are people who need surgeries for sure, because when you go into a chronic stage of sinusitis, the things don't work. The medical management usually doesn't work. Because we have to open the sinuses and we have to drain the mucus or the pus, and we have to permanently give the drainage. So the surgery we do is called FES, or endoscopic nasal surgery. Again, we have all the facility in our hospital for FES. It's a simple procedure. It's a one-day procedure. There is minimal bleeding. There is no cut, no scar, no suture in this type of surgery, and the recovery is fast. A few of my patients join their duties in 3 to 4 days time. Exclusively safe surgery, and we don't require general anesthesia. Also, in some patients we can do it in local anesthesia also. So very easy, and the success rate is incredible for the FES. Okay, now the question is, what happens if the sinusitis isn't treated? If the sinusitis is left untreated, you will have a continuous pain and discomfort, and the quality of life will be definitely compromised. But there are some severe complications. The infection can spread to the brain, and we can have meningitis. There can be a blood clot in the brain, which is called thrombosis. There can be an infection of the eyes, especially in children, because they have really thin bones. The bone between the nose and the eye is really thin. And I have seen many children presented in my clinic with a swollen eye, and unfortunately, a few of them did lose their vision because of this infection. So, and again, the bone infections. We have a lot of bones around the sinuses, so this infection can travel through the bone, and we can have various complications of bone infections all around our face. So that's why my appeal to you is, don't take it lightly. Sinusitis has complications, and there are some deadly complications for sinusitis. It needs a proper medical treatment. Lastly, now coming to the post-COVID sinus and nasal health. We are 1 year into this pandemic, and now we are in a post-COVID era, and we have started receiving patients for the last 6 months, which come post-COVID to the ENT clinic for the complaints. The first major complaint they come is the loss of smell. It takes time to recover. It really takes time. Between 4 to 6 weeks is the recovery time for the loss of smell. So anybody having suffered from COVID, they don't need to worry about it. They will hopefully recover fully. In some people, it takes 3 weeks, 4 weeks, and the maximum I have seen is 6 weeks for recovery of the smell. Dryness in the nose. The people come with the dry noses and the nosebleeds. A lot of people come with nosebleeds because of this dryness after the COVID attack. Again, I should say that there are ways to take care of this, and we can, in the next slide, I'll just show you how we can take care of this dry nose. Then dry cough. A lot of my patients suffered from dry cough. Basically, COVID causes drainage of all the nutrients and the mucus around our upper and lower airway, which precipitates dry cough. So again, dry cough can be cured with humidifiers, and we can give some treatment for the dry cough. It is advisable to see a pulmonologist, an internal medicine, or an ENT in case of these symptoms after your post-COVID period. So mostly, yeah, as I told, 4 to 6 weeks is the recovery period, and based on the studies which has shown that use of simple over-the-counter nasal saline irrigations, they can decrease the viral shedding in a setting of viral upper respiratory tract infections, including the common coronavirus. See, I say this fact based on the coronavirus which has been there since last 50 or 70 years. The coronavirus was there, and the common cold was caused by coronavirus. It is the SARS-CoV-2 which is causing this COVID-19. So for other coronaviruses, nasal saline did help, and few of my patients really improved after using nasal saline irrigations. And it's not harmful, it's just salt water, and it is freely available. If you don't want to purchase it, you can just boil salt and water and salt, simply mix it lukewarm, and then with a neti pot you can just rinse your nose. Having said so, this is a novel about the COVID. The last word about the COVID. It is a novel SARS-CoV-2 virus. It is having mutations. We saw a lot of mutations, and it is vital not to lower the guard and apply all the social distancing measures. And all who are vaccinated, good job. And those who are not vaccinated, I would advise them to get vaccinated as soon as possible. Thank you so much. Now I will be taking the questions and answers. Hope this presentation would have been useful for all of you. Thank you.
Thank you so very much, Doctor. It was really a wonderful presentation. You've really given a lot of information in all of
Thank
this
you.
information in this presentation, and I'm sure people would have got a lot of benefit out of it. Looking forward towards the question and answers. We've got some questions that has come up, so I would really like to ask you some questions. I've got a question here. Which will appear on your screen also. The question is from Mr. Zaid, and he says, Doctor, I did 10 nose operations for deviation and snoring, but there is no progress, and now I have a break in my breath, and I have a file in the clinic with you. Please contact me if necessary because I am very tired. How can you help with this?
Okay. The nasal surgeries. Can you please repeat the question, Fahad? Actually, I was, yeah.
Yeah. Doctor,
Yeah.
I did 10 nose operations for deviation and
Okay.
snoring, but there is no progress, and now I have a break in breath, and I have a file in the clinic with you. Please contact me if necessary because I am tired.
Sure. Definitely, having done 10 nasal surgery operations, that's a lot. That's a lot of suffering. I'm really, first of all, I have all my sympathies with you because undergoing 10 surgeries is not an issue. But we can reassess it. We have to do a nasal endoscopy. We have to do a CT scan. We have to assess where the problem is. So we will see to it. I will definitely call you back, and we can arrange a consultation with you, and we will be definitely helping you with this. We will
Thank you.
arrange
Thank
a
you
call.
very much. Absolutely. That'll be great. Uh, Doctor, looking forward, how do we do nasal endoscopy? If you can just give a brief on that.
Sure. Nasal endoscopy is a very baseline procedure. It's an easy procedure. We do it in the clinic, and we do it under local anesthesia. In some people, we don't even need local anesthesia. It's a tiny camera mounted on a scope, and we introduce it through our nose, and we see everything on the big screen, and then we prepare a report, and we keep a recording also for the future. It's a very easy procedure, very easy procedure. Just a
Thank
tiny
you.
camera is introduced in the nose, and then various steps are explained to the patient, and we see that.
Sure. Thank you. A question. I'm taking Sinopret tablets, if I'm pronouncing it right. Would you recommend to continue them?
Okay, very good question. It depends which stage of nasal allergy or sinusitis you are. We can arrange a callback, or you can pass by the clinic. You can come to the clinic, and we can really guide you because there are some guidelines according to the stage, which stage of sinusitis or which stage of nasal allergy we are in. Accordingly, I will be able to diagnose. So when I see you, when I clinically examine you, when I see the things, then only I can be able to recommend future for this. For sure, we will be arranging a call back or an email back to you.
Thank you so much. I've got another question here. Hi, doctor. I have nasal allergy, uh, rhinitis, and
Yeah.
watery mucus. But
Yes.
from few weeks, I have blocked nose and mucus is thick.
So, yes, a very good question. This is what happens is you have started from nasal allergy or allergic rhinitis, and probably it looks that you are going into the sinusitis phase. So from nasal allergy, you are having the sinusitis phase. You need a medical advice. You need definitely some medical management for this nasal mucosa, and we can arrange an appointment for you, or you can go to any doctor, and he has to give you some medical management for this condition. Basically, you are getting from nasal allergy to a sinusitis phase.
Thank you, doctor. Doctor, what's post nasal drip? How to cure it?
Again, it's a very good question. Nasal drip is of two types. Either we have drip in the front of the nose, we get a tissue and wipe it off, or we get some drip in the back of the nose. So whatever discharge from the sinus comes in the back of the nose, that is called a post nasal drip. It is very common in sinusitis patients, and we can get rid of this by using the nasal saline douching. It's freely available in the market. This nasal saline douching. If you need more help, you can please contact us, and we will be able to help you for this post nasal.
Thank you. Another question, doctor. My child, 10 years old, has got early morning too much running nose, which irritates him a lot. After a few hours, it's okay. Is it connected to sinusitis? Please advise.
Thank you. Very nice question. For children, this is exclusively what the history or what the short question says. It's mostly nasal allergy. It doesn't look like a sinusitis. So we can advise this child having a nasal examination in the clinic, and then using nasal saline drops, and I think it should be improved. There are various techniques for the children. We offer different treatment for the children for their nasal allergies, and it's worthwhile contacting the medical any of the medical practitioners, and we can help you. But it is surely doesn't look like sinusitis.
Thank you, doctor. Another question. What is right sinus aplasia, and is there a cure for it?
Okay, very good question. There are two sinuses. There is right sinus and there is left sinus. And aplasia is a Greek word. A means no, and plasia means formation. So, in some people, congenitally, one of the sinuses is absent. It is not formed by birth. So, whatever is not formed by birth, we cannot create it artificially, especially the sinuses. It is unnoticed in most of the patients. It's an incidental finding. For example, a dentist sends us a patient with one-sided sinus and other side there is no sinus. But what is important in people with sinus aplasia is whenever they go to a dentist, whenever they go to an ENT surgeon or any surgical procedure, they have to inform the medical practitioner, because if we have sinus aplasia and you go for a surgery, we can land up in complications. Although a very few people have headaches and nasal congestion and heaviness in the head, but usually 95% of the people with sinus aplasia are asymptomatic. The cure is
Great.
symptomatic. medical management
Mhm.
only, as and
Right.
when needed.
Understood. Absolutely. Thank you, doctor.
Yeah.
Doctor, another question coming in. I'm
Sure.
using Relvar inhalation powder since past couple of years after a major respiratory infection. Now I am better, alhamdulillah. Can I stop it now as I don't have any symptoms?
It's a very good question. See, the product you just named, it is for the lower respiratory tract. It is for the lungs. It is usually given in people who have asthma or people who are suffering from COPD. So I would highly advise you to take an advice from the pulmonologist or internal medicine physician, and he or she can better advise you regarding this. Yes. So we need to assess it with the pulmonologist, and then after we can give you a clear answer about this question.
Thank you very much. Another question from Ms. Aisha. She's saying, thank you for your reply for the first question. Also, what can be a quick relief to stop the allergy attack as I suddenly get these attacks at night and above continuous nasal discharge and itching in my ears and throat?
Sure. Thank you. Thank you so much. You are welcome for your question. The antihistamines, they are the quick remedies for an acute attack. You can have an antihistamine 2 hours before you sleep. That can help you. Plus, before sleeping, we can use nasal saline irrigations. Actually, it depends upon the grade of allergy, as I told in my presentation. Depends. You're having a grade one, grade two, grade three, or grade four. But as a shortcut, we can have an antihistamine, or we can have nasal saline sprays before sleeping, which gives most of my patients benefit, and they are quite at ease during the night with this treatment.
Thank you, doctor. Another question. Does allergic rhinitis and sinusitis affect the gums, pain, and swelling?
Yeah. Very nice question. It does. Not the allergic rhinitis, but yes, sinusitis. If a sinusitis is complicated, especially the maxillary sinus, which is right here, our teeth are connected to our sinuses. So if there is a sinus infection, which is for a long time, or if it is a complicated sinusitis, the pus can directly come into the teeth. And I have seen patients with a fistula, the connection from the maxilla to the mouth, which is called oroentral fistula. You should immediately talk to your dentist and get your gums checked, please.
Thank you, doctor. Uh, Patient with aplasia has continuous dripping in the back of the throat. Could it be because of a dental complication?
See, depends. Back of the throat is divided into two parts. One is back of the nose, and one is back of the mouth. So, if it is back of the nose, an ENT surgeon will help you. If it is back of the mouth, in fact, we can also help you. But I don't think it is a dental complication. I don't think, but we need to get it checked. It has to be checked. The oral and the nasal mucosa needs to be checked.
All right, thank you. Doctor, we had some questions pre-session, and we would really like to ask those questions to you. Some of our members have registered those questions. One of the questions says, what is rights? Okay, sorry. We've already answered one. How can I permanently cure allergic rhinitis?
First of all, allergic rhinitis, unfortunately, it doesn't have a permanent cure till date. We can manage the signs and symptoms, we can give relief, but as I told, allergy is in the blood, it's in our genes. So, whenever we get a trigger, whenever there is an allergen, we will have a reaction. It is an immune response. Although, there is a new therapy called immunotherapy, which is on the way. Immunotherapy means giving a small shot of allergen in very mild doses and increasing it day by day, day by day. Immunotherapy lasts for 2 to 3 years. There are two types of immunotherapy. There are immunotherapy shots, which are given in the superficial layer of our skin, and there are immunotherapy drops, which are put under the tongue. But this needs a lot of motivation. We have to continue it for at least 2 years. In my whatever research I did in last 4 years of my patients, around 40% of the patients did get better, but few patients are still having the same dose. So the response is mixed. It's still a lot of research is needed in immunotherapy.
Thank you, doctor. I've got another question here from Mr. Ever. He's saying one more question, please. Does sinus issues cause tinnitus also?
As such, sinusitis doesn't cause tinnitus, but as I told you, sinusitis can block the tube from the nose to ear, which in turn has effect on the middle ear. There is a mucus plug stuck inside the middle ear, which can cause tinnitus. It is very rare, but it is possible. Yes, you need to get your nose as well as your ears checked. We have a special test for it. It is called Proton audiology. We can do a complete ENT assessment. We can do an audiology assessment. I want to tell you that we have a high-tech audiology setup in our Prime Medical Center, Barsha, which is the latest, and we can do all the ear assessment in that lab. Thank you.
All right, thank you very much, doctor. Doctor, a very important question that has come up. What will happen if allergic rhinitis is left untreated?
Yeah, allergic rhinitis, if left untreated, as I told you in my slide also, it can cause two major things. One, it can proceed to a sinusitis. Any allergy untreated leads to sinusitis, and sinusitis can lead to the complication which I told: brain complication, eye complication, and the dental complications and the bone complications. Second thing is nasal polyposis. They can develop nasal polyps. Polyps are grape-like structures which, due to continuous allergic rhinitis, fill almost all of your nasal cavity, and it is impossible to breathe through the nose. It really compromises the quality of the life. So, yes, nasal allergy has complications if left untreated.
Thank you very much, doctor. Uh, moving towards the next question. I've got a question here. Doctor, how long can we take Montelukast, if I'm pronouncing it wrong, pardon me, for allergic rhinitis?
Montelukast. Yeah, again a very good question. This is one of the treatment guidelines which is accepted by American Rhinology Association or all the big authorities all around the world. And I have a personal research in it. It's a very good product. It's called Montelukast. It really helps in people who have asthma as well as allergic rhinitis. First, for my patients, I gave it for 1 month, that is 28 days. It comes in a 28-day pack. If the patient has severe allergic rhinitis, and if the patient, then we can be given up to 3 months. So 3 months is the safe period for this medication. 1 month we start, but it can be given till 90 days.
Thank you, doctor. Doctor, what are the most common triggers for allergic rhinitis?
The most common triggers, as I showed in my slide also, they are dust, they are pets, smoke, perfumes, pollen, grass. There are a lot of triggers. In fact, there are 252 triggers. That's why I'm telling you to come for this allergen test and get the trigger. It is different in different people.
Understood, absolutely. Doctor, what are the consequences of not treating infected sinuses?
Yes, there are complications of sinusitis. Again, I have already spoken about it and I will speak about it again. The infection can go through the nose to our brain. It can cause a brain infection, which is called meningitis. It can cause an abscess inside the brain, which is called brain abscess. It can cause a clot inside the sinus, which is called thrombosis. It can cause clot inside the brain. It can cause loss of vision. It has a lot of eye complication. And it can cause osteomyelitis of the bone or pot puffy tumor, what we call it. So it can cause nasal polyposis also. So overall, it's not a good thing to have.
Absolutely. Thank you. Doctor, where should sinus pain sufferers seek treatment actually?
Well, obviously, sinus pain sufferers have to see an ENT. They have, we can help them, and the destination of their this pain is an ENT clinic. We will help them. We will do an endoscopy, whatever is required, and we will give them the best treatment. So, sinus pain is for an ENT, and we have to get the results in an ENT clinic for sure.
Absolutely. Thank you so very much, Doctor. Moving towards the end of the session, but I'd like to ask you one more question before we end up the session. Doctor, what is required for a person post COVID or any essential things to do to be back and prolong good health?
Well, honestly, Fahad, or honestly, this COVID has a broad spectrum. It behaves different in different people. I have seen almost approximately 1,500 patients who pre-COVID or post-COVID. Honestly, it has a broad range. For each person, it comes differently and it presents differently. But having said so, overall, 4 to 6 weeks, I ask everybody to be patient. They will be fine. For sure, they will be fine. They will recover. Hopefully, or most of them recover fully as far as ENT is concerned. The smell does come back. 98% of the people do have their smell back. The nasal, the sinus complications are better after 4 weeks. Even the dry cough has a remedy. There are treatment protocols for dry cough. So we are just a phone call away, or you can log in our app and you can just book a consultation, and we are there to help you. I hope this is the answer of this question, Fahad.
All right, great. Thank you. Thank you so very much, Doctor. Moving towards the end of the session, Doctor, I just wanted to tell you that we've been receiving a lot of good appreciations. In fact, from the audience who are actually
Thank you.
watching and listening
Thank
to
you.
you. Of course, it has
Thank
been a
you.
great topic and a very important topic, especially at this very pandemic, actually, I should say. Thank you once again, Doctor. As
Thank you.
Doctor just rightly said that you are more than welcome to book an appointment with Doctor Shahriyar. You can log into our mobile application that you can see at the bottom, Prime Health Me app, that is for Android and, of course, for iOS itself. And you can book an appointment with him, or either you can always call and book an appointment with him also from 04707099 that you can see the number at the bottom of the screen. Please do share your feedback to us. That is very, very important. Your recommendation is important to us. Your feedbacks can be given on Google reviews or Facebook page Prime Health, and we will be more than happy to bring more good sessions for our audience, for our members. That'll be really great. If you have any still questions that you really wanted to ask, you can always send an email to us at myprime@myhealth.ae, and we shall come back to you. Thank you very much for joining us today, everyone. And we will be coming back to you with another live session with another great topic. Thank you so very much.
Thank you.
Thanks a lot. Take care. Bye bye.
Thank you. Thank you. Thank you. Thank you.